Hi, this is the second part of splenic artery embolization video, and in this we discuss techniques and procedure. Coming to techniques, splenic artery embolization is classified into two main approaches. First one is proximal splenic artery embolization. It involves occluding the main splenic artery, typically between the dorsal pancreatic and pancreatica magna arteries, using coils or vascular plugs. This procedure reduces arterial pressure to control bleeding while maintaining splenic perfusion. The splenic perfusion is maintained through collateral pathways like short gastric, pancreatic and gastroepiploic arteries, preferred for multifocal injuries or high-grade trauma. Next one is distal splenic artery embolization. It targets specific segmental branches of the splenic artery using microcatheters to deliver coils or particles 300 to 700 micrometers or glue. It is used for focal. Distal splenic artery embolization is used to treat focal injuries like pseudoaneurysms or localized bleeding. But there is a higher risk of splenic infarction due to limited collateral flow. In proximal splenic artery embolization, the splenic perfusion is maintained through collateral pathways. In this, there is a higher risk of splenic infarction. Next one is combined embolization. Combines proximal and distal techniques to address complex injuries, though it may increase complications like abscess formation. Fourth one is partial splenic embolization. Targets 50 to 70% of the spleen, often for hypersplenism or portal hypertension, to balance efficacy and safety. Selective embolization of mid-lower pole branches minimizes complications like pleurisy. So what are the four? Proximal splenic artery embolization, distal splenic artery embolization, combined embolization and partial splenic embolization. Coming to procedure, we can access through femoral artery or radial artery. Imaging, pre-procedural contrast enhanced CT is done, which evaluates splenic injury and vascular anatomy. Distal subtraction angiography during the procedure identifies active bleeding or pseudoaneurysms. Embolic agents, two types of embolic agents are used. One is permanent and one is temporary. Permanent coils, vascular plugs, particles or glue for durable occlusion. Temporary gel foam for temporary occlusion, though less effective. So permanent embolic agents are coils, vascular plugs and particles or glue. Antibiotic prophylaxis is done to reduce infection risk, especially in distal embolization or when flow to the spleen is poor. Pain management is done to prevent post-embolization syndrome, and it's managed with the post-patient controlled analgesia, steroids or anti-inflammatory. Medical students read about post-embolization syndrome, what are the types of embolization, techniques of embolization, what are the permanent substances that are used, etc.